Good afternoon, everybody. My name is Paul Campbell, and I'm a senior researcher at Midlands Partnership University NHS Foundation Trust. And I'm going to tell you all about the COAST project. Unfortunately, due to another meeting clash, I couldn't be live with you today, so I've done this pre-recorded video. But I have been given assurance that my colleague, Professor Kelvin Jordan, will be able to answer any questions that you might have about COAST after this presentation. So COAST stands for Collecting and Developing Adult Social Care Data for Research, and is a 12-month funded project. We're about halfway through now, in collaboration with Keele University, and the funding comes from the West Midlands Secure Data Environment. Now, in order to tell you about COAST, I'm going to give you a little bit of context and background to it, really to give you an idea of why we're doing this. And I'm going to start with the sort of wider context and something that we already kind of know, and that is that the use of electronic health records is a really good thing. We know it's well accepted by the public. We know that compared to primary data collection, where you've got to do longitudinal cohort studies over time, that electronic health records are quick, low cost, and available immediately. Electronic health record research has led to direct improvements for patients and services, and has also led to significant research capacity growth. So it kind of gets the thumbs up all round. However, we also know that electronic health records can be restrictive. It doesn't give us the full picture of the person who is also a patient, and further data sources are required to cover what is called the wider determinants of health. And I've put on the right-hand side there a diagram of the wider determinants. And then within that diagram, you can see I've circled the information you can get from electronic health records. So you can get everything about the healthcare services that are offered, and that might be, you know, the engagement, the contact, the consultations, the symptoms, the management, and even the outcomes. And you can get some demographic characteristics as well, but not many within electronic health records. And that means that we're missing a substantial amount of information that has been shown to be important in determining health outcomes. So other individual lifestyle factors for the person, importantly, information around their social and community networks, because we know social support has been very important in determining health outcomes, and also these wider general socioeconomic, cultural and environmental conditions, things like housing, living and working conditions, educational level. So these are sort of issues that electronic health records can't really provide. And that got us thinking about the context at MPFT. MPFT serves a very large population and delivers services across many places within England, and you can see that in the map in the middle. So it does have records that are kept both for mental health and physical health, but it also has additional data as well. Information on adult social care, children and families, specialist services like drug and alcohol and sexual health, learning disabilities, health and justice, psychological, public health, and many, many more. So it's got a fantastic resource there. And also MPFT as a foundation trust has very strong links. So it's got future potential to link with local government services, and they might be able to provide information around housing, education, environment, employment. We've got strong links to our primary care network, so we can get information from GPs and pharmacies. And we also have strong links with the third sector, with our engaged voluntary and community services. So that got us thinking about, well, with all of those resources at hand, could MPFT be a great place to create a research database? And that database would start to fill in many of these aspects of the wider determinants of health. And that took us to our first step, or a scoping project called Celestial. So in 2023, we applied for funding from the Clinical Research Network, as it was known back then, for a project to sort of scope out what we'd need to know if we wanted to create a database. And we had three key aims: understanding the processes required to create a database, scope out the feasibility of using different service sector data for research, because it would be multiple sectors involved, and also test whether the data from different sectors could actually be combined, a very important point. And I've just put the names of the people involved in the Celestial project in the text box below. So in that first objective about understanding the processes required to create a database, we had sort of three layers to the onion. The first one was public, patient and service user engagement to discuss issues around confidentiality, how people would give consent to being involved in a database, how we inform public, patient and service users, and also how we would involve and engage them in the actual running of a database over time. The second layer was really looking at the sort of regulation processes that are required at the sort of UK level. So the ethical and HRA approvals that would be required, the database governance, data protection, and all that sort of stuff. And then that enabled us to drill down to what is required at MPFT as well. So information governance, data protection impact assessment, data sharing agreements, and clearly the management needed to actually operate a database at the trust. The second part was really scoping out the feasibility of using different service sector data for research. And we focused on two areas of data for Celestial. Rheumatology data that's held in the portal system at MPFT, and also social care data that's held within the Care Director system at MPFT. And so that involved engaging with various people, so academics like myself, with data and IT experts, information governance and research governance and practitioners to plan out what we wanted to do, and also make a data request to have a quick look at the data within those sectors. So that was a data request, a front and back end view, really to give an initial description of the type of data that we're talking about. And an important part of Celestial was then to identify the processes for how data from different sectors could actually be combined. If you can't combine the data and identify an individual who receives social care services and rheumatology services, then there's little point in having an integrated database. So I've put a very simple diagram of this process on this slide. So you've got the live raw data that would come in from practitioners and clinicians within rheumatology and social care respectively. This information would be extracted by the database people and would cross a firewall, of course, where it would be anonymized. There would be the data linkage between the different sectors' data, and also the automatic creation of domains that can be used in research. So how did we get on in Celestial? Well, we managed to understand what processes are required at those levels of the onion. And we also managed to look and confirm that you could actually combine data from different sectors. There was a number of identifiable factors within each of the data sets that could be combined to ensure that individual A could be identified within one sector and the other sector. But where things differed a little bit was scoping out the feasibility of using different service sector areas for research. Because Celestial showed us that some data is more research ready than others. So the rheumatology data within the portal was almost collected with research in mind. So it's very much transferable to research, almost at the starting point. But it was clear that further understanding was required for adult social care data in order for it to be used for research. So that takes us to our step 2, the exploratory project on adult social care data, which of course is the COAST project. The COAST aim is to develop and describe and document the steps necessary to create a research quality data set from this routinely collected adult social care data. And we've got 4 main objectives. I've numbered them here, but actually the objectives run in parallel with each other, more or less. So the first one is to understand what the data is. The second is to, from that understanding, create an interactive data dictionary and a research toolkit. And the toolkit is really just to outline what steps that we have taken to create the interactive data dictionary. And in order to do that, we need full stakeholder engagement and obviously to create knowledge sharing and hopefully impact. And I've put the names of the people involved in COAST in the text box below. But what is adult social care data? And this is the sort of key question that we're learning about in COAST. So what I've done here in this slide is set it out in terms of when the person first engages with services all the way through the process. So you get an idea of the sort of data that's in there. So you've got your first contact and referral information and who makes that referral. Then you've got the initial screening or triage part to determine what level of care or urgency is required. Then you've got the needs assessment, and this is where the bulk of information and data would come from, because that really explores what the person's needs are, what the goals are, what the outcomes would be. Then you've got things like eligibility checks to open up a care plan. And then you've got the actual care and support plan, again, another area where the bulk of information would come in terms of data. Then you've got the financial assessment information. It's different from healthcare. It's not free at the point of contact. Then you've got the support plan and how that is implemented. And then you've got the longitudinal aspects of the case review and case monitoring. And also within adult social care, you've got some special considerations as well. Information around safeguarding, mental capacity and advocacy. So I think you can see that there is a real rich source of data within adult social care, not only to do research with other data like health data, but also as a thing in itself, which is really exciting. So in terms of understanding the data, we have started to sort of plan out what the data is and sort of we've got 3 levels of understanding. There is information in there that we clearly understand straight away. So on the first row of the table, you've got things like gender or sex, marital status, age banding. We understand what that is, and therefore that can be transferred into a data variable almost like for like. There are stuff that we're not 100% sure on, such as the middle row. So things where you've got a category called accommodation status with responses, the person is settled or unsettled, or key primary support reason. We kind of understand what that means, but we don't fully know how that translates and what that would translate in terms of data. So we need further work on that. And then we've got the bottom row where it's really speaking the language of adult social care, language that I don't speak as a researcher. So things like LT and SALT status, which I know is long-term and short and long-term care, and things like case priority. So we don't really understand what these are, but also what the circumstances are for why the choices are made. So further engagement is needed from practice, and that's part of what we're doing in COAST. So that's understanding the data. Then as that develops, we need to create this interactive data dictionary. So on the left-hand side, I've put some sort of figures for raw data, and these are ethnicity, gender and marital status, just as examples. But what we do then is create domains and map that out in the interactive data dictionary. So on the right-hand side at the top, you can see I've just put a couple of boxes there to indicate a demographic domain. That would split off into the components of ethnicity, gender, age, all those sort of things with the relevant subcategories. And I've put another example of a case domain at the bottom of the slide. Whilst we're doing that, we have our ongoing engagement with our stakeholders. So we've got researchers like myself, but we also engage with social care practitioners, service users and the public, social care leads, and also those with an interest in integrated approaches. So we know we've got integrated care, so we need to reflect that in people that have got an interest in integrated research as well. All of that then will transfer to our endpoints for COAST. And this is ongoing, but it will be done through a series of meetings, stakeholder events and workshops. And we've just recently had one stakeholder event. But the outcomes will be to agree and finalise the interactive data dictionary and the toolkit. Also raise questions about how practice could maybe improve data quality. We know from looking at the data that some aspects are not completed very well. Maybe they don't have to be, but we can explore questions about how that data could be improved for research purposes. We can also start to discuss how the database could be created, so this wider sort of goal of having that database. And from that, we can identify one or two key research questions that have got local relevance that we could test, and they could be used then to demonstrate proof of principle and take us forward to hopefully get some further funding. In terms of our dissemination strategy, we will have a web page developed. We've got our networks, local and regional, but if anybody's interested in getting in contact, just get in contact with me. We've got conferences planned and hopefully a publication or two that comes from this work. Okay, so that's all that I've going to present on the course project. I would like to say thank you very much for giving me the opportunity to share the work that we're doing. And as I said, Kelvin will hopefully be able to field any questions that you have about COAST. Thank you. Thank you.